There's nearly 15.2 million cases of coronavirus in the United States, while the death toll has risen to roughly 287,000 deaths. Hospitalizations are rising as doctors start to see what they're describing as a post-Thanksgiving surge. I want to bring on Dr. Taison Bell, Assistant Professor of Medicine in the divisions of Infectious Diseases and Pulmonary and Critical Care Medicine at the University of Virginia. A very long title there, Doctor. So I'm very excited to have this conversation with you. I shouldn't say excited, but I'm glad to have you here with us for this conversation. As we're starting to see these case counts rise, we're starting to see concerns over the virus rise with it. This is according to the latest poll from Ipsos. 60% say they are worried about the virus now. I'm wondering if you see that translating to any kind of changed behavior, at least when it comes to mask wearing and social distancing.
We certainly see a lot more concern in the community, and I think that reflects the fact that coronavirus is now very deeply spread across society. And we've seen numbers that, again, are very staggering, numbers I never thought we would see before: over 200,000 cases per day, over 100,000 in the hospital, over 2,500 cases per day. The sad thing about this is that we really haven't seen the peak of this. The post-Thanksgiving surge that we expected still is expected to go on another week or so, and we're going into Christmas. I have seen a lot more concern in the community for sure, but amongst our staff as well, because we're seeing people with families who are getting infected, and it seems like every day it's getting closer and closer to people that we know and love.
Now, this poll also said that about 20% of folks are engaging in risky behavior like gathering indoors. Wondering what your thoughts are on that, and if we can fight this pandemic with a minority of Americans continuing to engage in these types of activities.
Well, we know the nature of the virus is that it spreads, and it only takes a small number of people to have what we call these super spreader events, where it can spread widespread through an indoor closed setting. That's a setup for it. And then you go back to your home, and in-home transmission drives over 50% of the infections in the country. So this is very risky behavior. We have to keep getting the message out that it's time to really lock down and not go places unless you absolutely have to. Wear a mask, absolutely, physical distance, and wash your hands frequently. We're coming into Christmas, and I think, unfortunately, unless there's you have a member in your household there already, Christmas should be virtual this year.
So I want to pivot now to what is a little bit of a happier news or happier outlook, which is the vaccinations that have already started in the United Kingdom. The authorization of Pfizer's vaccine largely expected soon from the FDA, which means that Americans can expect to receive a vaccination, at least hopefully before the new year. But there's been this allergy warning attached to the vaccine. I'm wondering if you guys are worried as doctors that this could put people off taking the vaccine here in the United States, especially if people are getting sick, especially given the wariness that we've been seeing people really talk about when it comes to this vaccine, particularly here in the United States.
Well, first and foremost, I would say that transparency in this process is of utmost importance, because a lot of the concern has been around this has been very fast for vaccine development, and we're not sure what the data actually shows. We do have some data from the Pfizer trial, and we have this example from the UK. These were two recipients who both had severe allergies, enough to the point where they actually carried around EpiPens just in case. So a very different sort of predilection to having allergic reactions. I think what's important to remember is that in the actual trial data, hypersensitivity reactions, so things that approach allergies or allergy-like symptoms, were very, very rare. We're talking way less than 1% in the population. Thousands of people were vaccinated yesterday in the UK. And just for context, 1 in 1,000 people have died from COVID-19. Luckily, the two people who had the severe reactions, they're recovering well. They were in a healthcare facility at the time. So I think it's appropriate to have some caution for people who do have these severe reactions to that sort of extent. But by and large, this is a safe and very effective vaccine. I'm actually scheduled to take this vaccine on the 15th of this month, and I'm going in with absolutely no reservation.
Well, I definitely am going to want to have you back after you receive that vaccination to at least do some myth busting. I know some folks are a little bit worried and a little bit anxious that they're going to be feeling some pain or something like that after some of the shots, after we've been hearing some rumblings of folks reacting to this vaccination. I want to ask you about some of the data that we've been getting, and you were hinting at it a little bit earlier. So, the FDA, obviously, as I mentioned, considering authorization of this vaccine, the Pfizer vaccine. But AstraZeneca, so far, is the only company who's publishing their data in any kind of peer reviewed journal. The data that we've gotten from Moderna and Pfizer have been released to us in press releases. I'm wondering how necessary you think that step is of releasing that data in a peer reviewed journal, or if the FDA analysis of the data, of the efficacy, of the side effects, etc., could be enough.
Well, it is a very unusual way that we're having data released. So the usual process where data is peer reviewed and then released, and then there's a press release, just can't happen in this age where the virus is spreading so rapidly. We have to get data out there. In addition to the AstraZeneca trial, the FDA submission was a 53-page document that I reviewed yesterday that went over a lot of the trial data. And I was satisfied with what we saw as far as efficacy and in the low event of adverse events. So we're going to get this data as it comes out, but important to remember that there are 3 independent bodies that are looking at this data pre-release when it gets peer-reviewed and released in a journal. That's the Advisory Committee on Vaccine Practices housed in the CDC. These are the independent review committees that are set up for these trials. Each trial has an independent board that's looking at this data, and the Vaccine and Biological Related Products Advisory Committee that's housed in the FDA. These are all people that are experts across the country, across the world. They have no skin in the game when it comes to trying to get something rushed to market that may not be safe or effective. They're going to absolutely make sure that it works. And assuming that they approve it here in the US, then I have full confidence that it's something that we should take.
All right, Dr. Taison Bell, Assistant Professor of Medicine at the University of Virginia. It is always great chatting with you, Dr. Bell, but as I mentioned, I look forward to the day when we can have some happier conversations. Thanks for joining us today.
Me too. Thanks for having me on.